This is a condition that causes some of the most excruciating pain known to man. It's called trigeminal neuralgia, and it can be treated with surgical intervention. To treat this condition surgically, we will make an incision behind the ear, and we will make a hole in the skull, and we will gain access to an area called the cerebellopontine angle. Once we work our way down, we will find this artery called the superior cerebellar artery, which is pulsating, and every time it pulsates, it moves, and it will hit this nerve over here called the trigeminal nerve. And that's what we think the source of the pain might be, is this redundant trauma against this trigeminal nerve. So in order to spare this nerve, we will put a cushion, otherwise known as a pledget, in between the artery and the trigeminal nerve. By putting this cushion in between these two structures, every time the blood vessel will pulsate, it should not release any sort of pressure or force against that nerve. Now, this is an extremely effective way to treat this condition. Typically, we will use a medication called carbamazepine first. And if that doesn't work, we can consider other interventions that don't necessarily require us to drill a hole in the back of the head. For example, we can perform what's called a radiofrequency ablation rhizotomy. This is when we use heat to selectively destroy the pain fibers of the trigeminal nerve so the body can no longer sense the pain coming from the trigeminal nerve. We can also perform what's called gamma knife surgery, where we focus a beam of radiation onto the trigeminal nerve, and this is typically done for patients that are not suitable for surgery. We can also perform a procedure called a balloon compression, which is also a similar concept to the radiofrequency ablation, where we destroy some of the fibers that are causing the pain.